Blood exposure procedure, 10 minutes. You will demonstrate the blood exposure procedure. You will imagine the following scenario. During a service, your client has sustained a minor cut to the forehead. The injury is such that you can continue with the service. You have not come in contact with the blood and your work area has not been contaminated. You are expected to demonstrate the proper procedure for blood exposure. You will be expected to follow all client protection, safety, and infection control procedures. You will have 10 minutes to complete this section, and you will be informed when you have 5 minutes remaining. Step back to indicate you have finished. You may begin.
Okay. I'm going to sanitize my hands. And then I'm going to open my first aid kit on my SMA. I'm going to set my first aid kit bag aside and put on my gloves. Let me pause it really quick.